Hello, everyone, and welcome to Mustard Seed Nursing, where we believe that the fear of the Lord is the beginning of all knowledge. In today's episode, we'll be talking about magnesium, and we will be going over the normal serum levels of magnesium, foods that are high in magnesium, and then we'll be talking about hypomagnesemia and hypermagnesemia. Okay, so let's get right into it. So the normal levels of magnesium, normal serum levels, are 1.6 to 2.6 milligrams per deciliter. So that's 1.6 to 2.6 milligrams per deciliter. Okay, and as we said before in our previous episodes, it is very important to know your normals because that's where the basis of a lot of these test questions will come from. Now, for foods that are high in magnesium, I'm going to go ahead and list here of my script that I'm reading from, a good list that you should commit to memory. Okay, so avocado, canned white tuna, cauliflower, green leafy vegetables, milk, oatmeal, wheat bran, peanut butter, almonds, peas, pork, beef, chicken, soybeans, potatoes, raisins, and yogurt. Okay, so it's quite an extensive list of things that have magnesium in them, right? And I'm going to go ahead and list it one more time before we move on. So avocados, canned white tuna, cauliflower, green leafy vegetables, milk, oatmeal, wheat bran, peanut butter, almonds, peas, pork and beef, chicken, soybeans, potatoes, raisins, and yogurt. Okay, so I'll put right here, as you see, I'm drawing just pictures of the foods so that this could help you to memorize. And I do encourage that you do that. You actually put pictures together of these different foods and just have them somewhere in your room or somewhere with you so that when you're studying, you can easily remember. All right. Now let's jump into hypomagnesemia. So hypomagnesemia is defined as serum magnesium levels that are lower than 1.6 milligrams per deciliter. So lower than 1.6 milligrams per deciliter. Now, what causes this? There can be many things that cause low magnesium, right? For one, we can have inadequate intake of foods containing magnesium. We could also have malabsorption taking place, and that could be due to diseases such as celiac disease, Crohn's disease. Those are absorption issues that we would have to overcome in order to promote more absorption of magnesium foods. Vomiting and diarrhea can also cause low magnesium levels. The excessive removal of magnesium from the body, as is the case with kidney disease or malfunction. And we also can see low magnesium levels for the chronic alcoholic, right? So chronic alcoholism can cause low magnesium levels. And I've seen this a lot on my unit at work. So we will see alcoholics coming in. They will be low in a lot of different vitamins, minerals, and electrolytes. We'll give them what is called a banana bag. We call it a banana bag because of the color, but what it really is just a lot of vitamins and a lot of electrolytes in that bag. And one of the main ones is like, vitamin B1. They lack a lot of thiamine and it could cause beriberi. So we will definitely be giving them a lot of vitamins and minerals. All right, now overactive movement of magnesium into the cells from the vasculature subsequent to hyperglycemia could also be a factor that affects magnesium levels and cause them to become low. So that intracellular shift of magnesium could also occur as one of the causes of low magnesium. A side note to make here is while caring for a patient with low potassium levels, you also want to check the magnesium levels. I think for low potassium and low magnesium, they kind of go hand in hand. And what I've seen is that if my potassium levels are not holding up, if I'm giving a lot of potassium and it's not holding, then I normally firstly look on my magnesium levels to see what they are, because if they're low, then it doesn't matter if I give more and more and more potassium, it won't hold, right? We need to give magnesium as well. Now, signs and symptoms of hypomagnesemia include the following. So one, we could have twitching and paresthesia, numbness and tingling happening. We could have positive Trousseau's and positive Chvostek sign. And I know that might be something that you will see with hypocalcemia, but you could also see it with hypomagnesemia as well. Hyperreflexia is also a common sign or symptom of low magnesium, and that's basically like when the deep tendon reflexes are just very active, right? You're seeing an over exaggerated reaction from exciting one of the deep tendon reflexes. You could see tetany, you could see seizures, irritability and confusion. So if you're really looking at these signs and symptoms, you're seeing that things are kind of like speeding up, right? These signs and symptoms are very similar to hypocalcemia, right? So you're going to have tachycardia as well, hypertension. The T waves are going to be tall T waves and depressed ST segments, okay? So we need to do something for these guys. What are we going to do? All right. So number one, nursing action and interventions that we're going to be taking are going to include placing the patient on a cardiac monitor. I want you to remember this condition, torsades de pointes. This is a lethal dysrhythmia. It's really a form of VTAC. We call it a polymorphic ventricular tachycardia, and it can quickly degenerate into ventricular fibrillation, right? So we treat this with magnesium sulfate, okay? So this is one time where low magnesium can literally cause a lethal dysrhythmia, right? And it's called torsades de pointes, right? I think this is like French or some other language. It's TORSADE and then space DE space POINTES. However you want to say that, but look into that, okay? And the treatment for that is mag sulfate. All right. Another intervention that we're going to be taking, we're going to be frequently checking both the magnesium and the calcium levels. A lot of time when you have low magnesium, you're also going to have low calcium levels as well. Although magnesium can be given orally, magnesium does have this tendency to cause GI upset leading to diarrhea, right? Which is even going to worsen the problem more, right? So we want to kind of shy away from oral magnesium if we can, and we want to give magnesium in the IV route, right? And in the hospital, what I've seen a lot of is like 2 grams of magnesium. It's in a little small bag, and that's how we normally give magnesium. It's a favorable route. You just need to give it very slowly, right? So that we don't swing the pendulum in the other direction. You also want to initiate seizure precautions for the low magnesium patient. Initiate seizure precaution, and you want to monitor the deep tendon reflexes frequently during and after magnesium administration, because if you see that the patient has become too weak, the patient can't breathe, then this patient might have hypermagnesemia, meaning that we've just created a whole different problem of swinging the pendulum in the other direction. Okay, now on that note, let's talk about hypermagnesemia. Okay, and I don't know why I'm so happy to talk about hypermagnesemia. All right, so what do we define this as? We define hypermagnesemia as greater than 2.6 milligrams per deciliter. So when the serum levels of magnesium is greater than 2.6, then we say the person is hypermagnesemic. Causes of hypermagnesemia include, number one, when we have many antacids and laxatives that we're taking that contains magnesium compounds. So if we're overusing these substances, then that can definitely cause high magnesium levels in the serum. When we're treating low serum magnesium, as I said before, if we run the infusion of magnesium too rapidly or too much, if we give too much magnesium, then that could cause hypermagnesemia. For kidney malfunction resulting in the inadequate excretion of magnesium, right, otherwise called renal insufficiency, then we could that could cause hypermagnesemia. Okay. Now, what are the signs and symptoms or the clinical manifestations of hypermagnesemia? All right, let's go through this list. Number 1, bradycardia and dysrhythmia, right? And we already know why that is. We know that the heart loves its magnesium and its calcium in normal limits, right? So I want you kind of to also remember that when there's a lot of calcium or when there's a lot of magnesium, the muscles of the body kind of tend to slow down, okay? And when there's too little magnesium or too little calcium, things tend to speed up. So bradycardia or dysrhythmia, hypotension could also happen, weak respirations, diminished deep tendon reflexes, skeletal muscle weakness, drowsiness, or lethargy, as well as prolonged PR intervals and widened QRX complexes. So everything is kind of like just slowing down with hypermagnesemia. Okay, so what are we going to do for these guys? Number 1, we're going to place the patient on cardiac monitor. Why? We want to see what that EKG is doing, right? Want to look at that heart, want to see what the EKG is doing. So place the patient on cardiac monitor, okay? We want to administer diuretics to help us to remove some of that excessive magnesium that we have in the serum, right? And then we want to administer calcium chloride or calcium gluconate for these patients that have high levels of magnesium in the blood. Actually, calcium gluconate is an antidote or is the antidote for magnesium overdose, right? And that's important for you to remember. The patient has way too much magnesium, it's at a critical level, it's at a severe level, then we're going to administer calcium gluconate, right? And then calcium chloride we can also administer because this kind of helps to prevent the harmful effects of hypermagnesemia on the cardiac muscles, and that would kind of help us to just prevent, just a lot of damage that we cannot come back from. Okay, so we want to prevent that, and calcium does help us to do that. All right, and also we want to restrict foods that are high in magnesium for the patient that already has too much magnesium in their serum. Okay, so that's it, guys, for this episode. Join me on the next episode when we delve even deeper into these lovely topics.